So good morning, everyone. My name is Amanda Teisinger. I am the program director for Revital. Just to kind of give a little background of what Revital is with Rush Physical Therapy. In December, Rush joined a joint venture with Select Medical, which were previously known as NovaCare Physical Therapy centers around the Chicagoland and Northwest Indiana area. So they are now co-branded as Rush Physical Therapy. And within that company is Revital Cancer Rehab. So that is a national program. Our therapists undergo additional education and training to better help treat in a more optimal way those affected by cancer, including lung cancer, head and neck cancer, breast cancer, et cetera. So we go through some pretty extensive training to get our certification. And the best part is now I've been a physical therapist for 8 years, working with the oncology population about 6 of those years. And one of the limitations I've really found with that is access. Patients typically have a ton of appointments, and it's been hard to include rehab services in addition to that. So just so you know how to find us, Rush Physical Therapy is now across all of Chicagoland area with these specialized therapists. So again, hoping to bridge that gap for patient access for these rehab services. So in our today's talk, we're going to do a brief overview about lung cancer, mostly on treatments. And I'm hoping to guide that more towards how that's going to impact your functionality and your movement. And then I'll hand it off to Leslie to discuss deeper into rehab services and exercise for lung cancer, and then open up to questions and discussion. But I want to keep this a very casual conversation. If you have any questions at any time, please raise your hand, and we're happy to accommodate all those questions as they come up. So we just want to start off with a poll just to see how everyone's experience has been, if you've had any experience with rehab services. So please feel free to jump on and answer that poll. Right. Okay. Really interesting. So very almost a 50-50 split of you did and it was wonderful, or you've never had rehab services. So happy to hear both. And again, if you've had rehab services and what you enjoyed about it, please feel free to jump on at the end and share what you enjoyed and what we found helpful. And if you've never had rehab services, maybe by the end of this conversation, you'll be able to think, maybe this is something I should look a little bit more into. Okay, so again, brief overview here for lung cancer and staging. So staging for lung cancer follows the international TNM staging system, meaning size and extent of tumor, extent of regional lymph node involvement, and the presence or absence of metastases. We also have our NSCLC stages. Stage 0 indicates that cancer is where it started and hasn't had any spread. Stage 1, the cancer is small and hasn't spread anywhere else. Stage 2, the cancer is grown but hasn't spread. 3, the cancer is larger and may have some lymph node involvement. And stage 4 is finally what we know as secondary or metastatic cancer. SCLC stages are also described as limited or extensive. So what is important is that the cancer for limited is confined to a small area, enough to be treated with just radiation therapy in one port or one treatment area. Extensive meaning it's kind of spread widely throughout the lung to the other lung, or to lymph nodes on the other side of the chest or parts of the body. Some risk factors for lung cancer are tobacco exposure, secondhand smoke, exposure to radon, asbestos, are other carcinogens, including uranium, diesel fuel, arsenic, or any other inhaled chemicals, any previous XRT to the lungs, air pollution, or a personal or family history of lung cancer. So now I'm just going to do an extremely high-level overview of lung cancer treatments. Again, discussing more kind of the impact we're looking for on how that's going to affect function. So surgery, there's 4 options I have on this slide here. The wedge resection is the removal of a small wedge-shaped part of the lung tissue surrounding the cancerous tumor. So as a therapist looking at someone with a procedure of a wedge resection, I'm immediately starting to think of, is this surgical cut going to impact shoulder range of motion? Is that port, if the patient had chemotherapy, is that on the same side? How is that impacting shoulder function? Again, that impact on gross posture as well. A segmental resection is where each lung lobe is made up of 2 to 5 lung segments. So surgeons can remove 1 to 4 of those segments of certain lobes and save the uninvolved tissue. So a little bit larger of a cut. Here I'm also thinking, again, postural impact, shoulder range of motion, and here I'm also thinking about any impact on breathing mechanics. Lobectomy, the right lung is divided into 3 lobes. The left lung has 2. And a lobectomy is the removal of the lobe of the lung affected by lung cancer. This is also the most commonly performed lung cancer surgery. Heavy impact on range of motion, shoulder, thoracic range of motion. If you're thinking of where that cut is, scarring can bring you forward and really impact kind of that ability to open the chest and get better breath. You're also thinking of the impact on endurance because a section of the lung has been removed as well. So thinking about building back the endurance with breath. And then finally, a pneumonectomy. That's the removal of an entire lung affected by cancer. So these are our patients who we're monitoring oxygen levels, we're monitoring vitals, and we're slowly building them back up to that endurance level because there's been a significant impact on their ability to breathe. Other options is a thoracotomy. So that's an incision on the side of the chest following the curve of the ribs. It usually involves dividing some of the muscles with an instrument to gently spread the 2 ribs to provide that surgeon access to the lung, and then the muscles are repaired when the incisions close. Again, thoracotomy, I'm doing a ton of breathing mechanic work with these patients. And then we also know minimally invasive surgery is much more accessible to us now. So if you've heard of VATS, which is video assisted thoracoscopic surgery, and it's commonly done with the assistance of a surgical robot. So chemotherapy, we're looking at, I'm not going to read out the entire list, but some big standouts on this list when I'm looking at a patient on their history with chemotherapy. I'm looking at if paclitaxel's on there, albumin-bound paclitaxel and docetaxel. So any of those taxels are what we call taxanes, and these are neurotoxic, meaning they can have an impact on the nervous system. So these are patients where I'm going to be asking about any numbness, tingling in hands or feet, noticing any instability or they can't really feel where they are on the ground as well as they once could. I'm asking about any falls, difficulty with the hands, like buttoning a shirt, or noticing they're just dropping some objects some more. These are all things that we can work on in therapy and focus on some balance training and some re-education to kind of work on getting those fine motor and build up that proprioceptive knowledge that was lost because of the chemotherapy impacts. Radiation, there's both external beam and brachytherapy. Thinking of the impacts of radiation, radiation has significant soft tissue changes on the area that's been treated. I'm especially thinking about that if there's radiation commonly in the same region as that surgery. So we're looking at challenges with healing, challenges with that soft tissue movement. So working a lot with these patients on actual soft tissue work to get that area to move a little bit better. and prevent radiation fibrosis, which is kind of that hardening of the tissue. And then we also have targeted therapies. There's different for both non-small cell lung cancer and small cell lung cancer. Big thing I'm thinking of if I'm seeing these targeted therapies with the patient is any impact on performance. So these are commonly associated with low blood pressure. So again, monitoring those vitals and asking patients questions of dizziness and allowing adequate rest during our sessions as well. And then lastly, palliative care, having any involvement in the patient's case as well. Typically, we're usually doing some partnering with palliative care because our goal is to make that patient much more comfortable and manage those pain symptoms. So working alongside with that referral to get you guys moving better and have a little bit more control over that pain. So why is cancer rehab important? So evidence suggests that 60 to 90% of people affected by cancer could benefit from the skills of a trained therapist. However, less than 2% of these patients are actually having their rehab needs addressed. And we saw that too in the poll. So it was about a 50-50 split on if people have received cancer rehab or not. And a lot of that is due to, like I spoke out to earlier, that limited access. Hard to find a therapist with that specialized training. Sometimes cancer care teams also aren't educated on the full scope of services that therapists can offer to their patients. And again, it's just incorporating it into that practice workflow. You know, is the physician asking about things like balance, falls, mobility, range of motion? So just being mindful to ask yourself those questions. Am I moving how I once was? Is there some work we can do to get back to that level? So from here, I'm going to hopefully answer that question by handing it off to Leslie to talk a little bit deeper on more what rehab services offer for lung cancer patients.
Thank you, Amanda. Hello, everyone. Thank you so much for having us, Brittany. So I'm going to talk more about what more the rehab process is like, what we're looking for, and we'll have a fun interactive session at the end where you can try on some things that we might work on in the clinic. So speaking to the musculoskeletal effects, so what is affected with having lung cancer, its treatments, so talking about physical hardships, so physical effects, and then when you're not able to move like you want to, do the things that you used to be able to do, that's just going to affect your overall quality of life, and put more stress on yourself, more burden on yourself, and just everything becomes affected. So what you're doing day to day, getting dressed, do you have enough range of motion, enough movement in your torso from treatment or just from the cancer, for getting dressed, for taking a shower, being able to lift things, of course, per your medical oncologists or surgeons, as long as you don't have restrictions with lifting, but making sure you're able to do all the strengthening things, such as lifting laundry or groceries throughout your day, and then can also have impairments such as fatigue, shortness of breath, coughing, pain, of course, and some insomnia, so trouble breathing or trouble sleeping. So physical therapy can actually help you address all of those impairments. So oftentimes at diagnosis, since lung cancer patients are often diagnosed stage 3, stage 4, cancer's already been affecting them and having decreased muscular strength. And just with nutrition, having better nutrition, if that's what you're already working on, not just that, can help your strength. You also have to do these strengthening exercises in order to get all of your strength back. Nutrition is very important. So working with the dietitian, having your full oncology healthcare team is very important. So with diagnosis during treatment, it has been found that functional decline is rapid, happens pretty fast, and is common. So historically, lung cancer rehab services have been only in the inpatient setting. So while you're in the hospital, treatment, post-surgery. But over the last 10 years, research has shown that exercise-based rehabilitation, so getting out into an outpatient clinic, is very helpful. Research supports it. As you've seen with the numbers, patients need physical therapy, need to have their impairments addressed, their strength impairments, their fatigue impairments. The only thing that has been shown to be helpful for cancer-related fatigue is exercise. So let us help you get the motivation, get you back into exercising and being able to do even just your day-to-day activities. So what does it look like when you come into a physical therapy evaluation? Well, we will listen to your impact of your environments, the impact that the cancer is having with your day-to-day activities, and how different treatments are affecting you. So as Amanda had described all of the effects that the various treatments can have. So you can have range of motion issues, posture, how you're walking, the balance, all of that sensation, strength, all of that. Want to hear verbally how it's affecting you. And then we'll get into the measurements. So objectively measuring your muscle strength, the range of motion, looking at your posture based on normal findings. And then we do some functional outcomes that are great baseline measures as well. 6-minute walk test. So that's a good one for endurance. So how far can you walk for 6 minutes? Timed up and go. So that's more of a balance and walking speed kind of test. And then grip strength. And so all of these have been related to functional decline and what we call frailties. So getting weak, more related to morbidity measures. So we want to get these baseline measures in order to see where you're at compared to quote norms, and then help you address based on these baselines, monitor with reevaluations. If we notice in a month or so that we want to hopefully see improvement. If for some reason there's any kind of decline, maybe you haven't been able to make it to PT as much because of your other medical appointments, then we really want to target in and address the impairments related to these functional measures. So the idea is actually that we see you at time of diagnosis or right after you get diagnosed with cancer. That way we can get the baseline measures. If you're having surgery, we are assessing if you're appropriate for surgery, and if not, addressing any impairments in order to help you become operable, able to have surgery. And then also with what we call prehab, so doing physical therapy before surgery, that's actually been shown to allow you to have better outcomes post-surgery. You're already have, good strength, you already have the range of motion, and then it's easier to get all of that back after surgery. But if we don't see you, just as a note, if we don't see you right after diagnosis, we will certainly welcome you at any time to help you with any impairments. And then, so there's still emerging evidence to support prehab, although the evidence that is out there has been very positive for supporting it. It's still not standard, but of course we would like it to be, and evidence is going that way. But of course, if you are scheduled to have surgery, surgery comes first if you are ready to have it, appropriate for surgery, and don't need to complete any kind of prehab plan of care prior to having surgery. And then for immediately post-operatively, so you are still in the hospital, we want to address any pulmonary complications, so any trouble with your breathing, working on breathing techniques in the hospital, as well as any noticeable range of motion, strength, functional issues, standing up out of bed, moving to the toilet, taking a shower. We want to help with all of those right away. And that's in order to help safe and timely discharge back home. And so most patients post lung resection will be discharged to home directly rather than to any kind of rehab facility. So for the goal of post-treatment, so getting post-surgery or other treatment interventions, so post chemo, radiation, time to get back into an outpatient physical therapy clinic. We want to get back to your daily activities, as well as maximizing your what I talked about at the beginning, your overall function, how you're feeling. As I'm sure you know, your mental health is affected by your physical health. So we take surveys basically at the beginning of evaluation and every evaluation as well, to make sure that not only your functional status is improving, but your mental health is improving as well. So it's really nice to see when both the mental health is improving along with your physical health. All right, so those in advanced stage lung cancer, we really want to prevent that deterioration. I had a patient recently, it wasn't lung cancer, but she was in stage 4 metastatic cancer, and she just wanted to be able to move better, to be able to walk her dog. And it was, she's in a lot of back pain, but to be able to just be able to get out and walk her dog, her main goal. And so she was coming to therapy, and that was the one thing we were working on. So we really want to be able to help you with your main goal. You should still be able to do the things you want to do. And so we want to help you be able to physically do that. So, and especially because adherence, so your compliance with exercise and movement is higher when it is a supervised training. So we will give you a set program and, guide you along the way with your physical activity. But maybe having this condition, having advanced stage lung cancer, you might feel like, oh no, I should stay home. I shouldn't go out in the world. So you want to do home-based therapy. But you should be able to live and have a good quality of life. And if that is your goal, then you should get out into an outpatient clinic. We'd be happy to see you. And if you want to take some time first, we do have telehealth options. So we could get started with telehealth and doing some exercise at home via a platform similar to this, and then maybe eventually with getting a little bit of movement back in your body, you can come back into the clinic and work on some larger goals. So palliative care, kind of similar to what I was speaking about. We are working on that. So the HRQOL, that health-related quality of life, the mood, right? The more you're moving, better. When it's easier to do things, your mood is better. We just really want to maximize your independence, right? We all want to be independent as long as possible. So we want to help you be able to do that. So some of the interventions we would work on include managing your breathlessness. So if you're feeling short of breath, we can work on breathing techniques, relaxation techniques, so helping to manage your stress with your condition, all of the related burdens with your condition, help you manage that. Activity pacing, so if you're feeling fatigued, get fatigued really easily, help you manage how to break up your day, do small tasks throughout your day, help you manage how to break that all down, so that you are able to actually accomplish more. Also, assistance with mobilization. How are you getting around? Are you having to use an assisted device? And then as well as working on those functional exercises. So standing up from a chair, do you need assistance with that? What is the best way to do that? Looking at your mechanics, looking at your muscle activation. We can help you make those things easier. Even just getting up and making your way from the couch to the kitchen, whatever it may be, washing your hair, all those little things. We have ways where we look at your mechanics, how you're currently doing it, and then based on your impairments, what is the best way, the easiest way for you to be able to accomplish those things. So the big thing about exercise for those who have cancer is that it's a good thing to do. It's recommended. You should actually be exercising, working up to the recommended amount for even those who don't have cancer. Of course, working on pacing yourself at the beginning if you haven't been exercising in a while. That's where we come in to help you break down and know what's safe for where you're at right now and how to get to the recommended regular exercise amount. So maybe try just 10 minutes at a time. So, getting up, even I like to tell my patients, even just put on your favorite music and walk around your home for 10 minutes. So even if it's, cold outside or, you don't feel comfortable right now walking outside, get up and just walk, just move for 10 minutes at a time. Start there. Want to avoid inactivity. That's when we start getting issues with range of motion. We start losing our strength. Things become more difficult, right? If you don't use it, you lose it. So, and like I'd said before, just want to reiterate, the evidence has shown that the only thing that really is effective for decreasing cancer-related fatigue is exercise. So that regular amount that we're building up to is 150 minutes of moderate intensity aerobic activity, or 75 minutes of vigorous intensity aerobic activity. And so that moderate, vigorous, those differences in intensity, and most easily based on your heart rate, most directly based on your heart rate. And so working with a physical therapist would help you determine, based on your age, your resting heart rate, using a whole calculation to determine what would be the best goal for your moderate intensity or vigorous intensity, depending on your goals. Besides the aerobic activity, the aerobic exercise, you want to do strength training. You want to keep up your strength as patients get older. Yes, you do tend to lose strength, but the great thing is you can strengthen, you can increase your strength. You just have to work on it. So strengthening at least 2 or 3 times per week, working all the major muscle groups. Don't know what to do, see your friendly neighborhood Rush PT, Revital certified, and we can help you get a whole program for you, addressing all your major muscle groups, get that strength back in your body. Very importantly, we want to begin each workout with a warm up and a cool down, doing a dynamic type warm up, dynamic type stretching for your warm up. And then for cool down, you can do some more sustained stretching, holding for 20 to 30 seconds, some hamstring stretching, maybe some quad stretching, reaching the arms up. We'll do a little bit of that in a little bit. But really the important takeaway is avoid inactivity, and it is safe for you to exercise as long as you start out at whatever level you're at right now, and gradually progress. So if you don't feel comfortable doing that on your own, please reach out and see a physical therapist. So this, the RPE, so this is a way to monitor your exercise intensity. So besides getting the heart rate calculation, so this is the rate of perceived exertion. So 2 different scales out there. This is a 0 to 10 one. There's also a 6 through 21. But just thought the 0 to 10 sometimes can be a little easier to understand. So 0 means that you're at rest, you're doing no activity, you are not exerting yourself at all. You are sitting or lying down. Then I'll go through all these, but basically increase your intensity, very light, watching TV, moderate. You can do this activity for a while. It's a little challenging, but you're able to carry a conversation. It's some work. Somewhat hard, your breathing increases, breathing becoming a little heavy. You can hold a short conversation, but still comfortable, but you definitely notice it's challenging. Hard, where the breathing is even more heavy. You can only speak a short sentence at a time, likely sweating, getting pretty uncomfortable, extremely hard, very difficult to maintain. This is one you might only do in short bursts, can barely breathe or speak a few words, and then almost impossible to sustain. We won't even go there. You should not be there. So with getting started with exercising, haven't been doing it in a while, this 3 to 4 range, it's moderate range. It's a great place to start. If you are getting up, doing that walking, maybe you notice after even just 5 minutes, or maybe just 3 minutes if you've been doing a lot of sitting around, you feel that you could maintain it for a while, but it's starting to feel a little challenging. You can hold a conversation. Maybe you'll just stop there for now, because this is this is more exertion than you've done in a while. So start here, get to this level, stop, maybe later in the day, get back, do a few minutes, get to this level, stop, then gradually add on a minute or two at a time. Eventually working up to the 5 to 6 level. So this is somewhat hard. This is a great place to consistently be exercising. So once you build up to this level, your breathing increases, becomes heavy. You can still hold a short conversation like you are, still feeling in control, I'd say. It's still pretty comfortable, but notice it's challenging. You want exercise to be somewhat challenging, somewhat hard in order to progress. All right, now the fun part. So talking about breathing, as lung cancer can obviously affect your breathing. Not only the cancer, but the treatments, post-surgery. So the diaphragm, the muscle below the rib cage, is the most efficient muscle for breathing. It is actually a muscle, so we do want to pay attention to it and strengthen it. And so with strengthening it, the benefits include decreasing the work of breathing by slowing your breath rate so you get more control of the diaphragm. Your breath slows down and the work of breathing becomes less. So therefore, then it decreases the oxygen demand, not having to work as hard to get oxygen, so you don't need as much. And therefore altogether using less effort and energy to breathe. So we can try this simple exercise. These pictures shown laying down, this is kind of a great starting position, lying down, getting your body in kind of like a most optimal posture position, pillows supporting the legs. Everything else is relaxed so that you can just focus on the diaphragm. You can certainly also perform it in seated as well, which I welcome you to join me in doing. I'm going to shift back here so you can see my whole rib cage and diaphragm a little more. All right, so I'm going to have one hand on my chest and then one hand at the bottom of my rib cage. So the hand at the bottom of the rib cage, that's basically on your diaphragm. And so start taking some deep breaths. You want the breath to come in through your nose. And as you exhale, do it through pursed lips. Inhale through your nose. Exhale out with pursed lips. And as you inhale, you want to feel that bottom hand expand. And as you exhale, the bottom hand compresses back down. Breathe in. Bottom hand expands out. Exhale. Bottom hand falls back in towards your spine. Breathe in. And exhale. So with this practice, you can do a little strength and endurance building for the diaphragm by increasing your how long you're holding each breath or how long you're performing each breath. So I'm going to inhale for 2 counts. Inhale, 2, 1, exhale, 2, 1, inhale, 2, 1, exhale, 2, 1. Now 3, inhale, 3, 2, 1. Exhale, 3, 2, 1. Inhale, 3, 2, 1. Exhale, 3, 2, 1. Up to 4. Inhale, 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. We'll stop there. Imagine you get the idea. If you have questions about that, by all means, please ask. But that's the idea. Very important to strengthen, get control, build the endurance of this muscle. So besides that muscle, we also want to make sure that the muscles around our rib cage are stretched out and therefore allowing the diaphragm and the rib cage to expand. So this is a great simple stretch you can do, just seated again. So I'm going to reach one arm up and over, a little bend towards that side. And then you're going to take those same deep breaths you were just working on. You want to feel the muscles between your ribs expand. Exhale out. That side of your rib cage should expand as you breathe in. Feel it stretch. And exhale, bend. I like to hold for about 3 to 5 breaths. Exhale, let's do one more. Big breath in. Exhale. All right, got to make our sides even. Other side, arm up and over. Inhale, feel that side stretch, rib cage separate. Exhale, ribs separate, that is. Good, big breath in. Exhale. 2 more breaths. Inhale. Again, this is stretching the muscles around your rib cage, around your lungs to help you breathe a little easier. And come back up. So a great stretch to do 1 or 2 times a day. And yeah, that'll just help you breathe easier as well. All right, now into some strength training. It's a great exercise to work on leg strength as well as your functional ability to stand up from a chair. Those muscles are also helpful for walking, for going on stairs. And this actually has a balance component too. Some people feel a little unsteady for standing up from a chair. If that's the case, if you don't feel comfortable practicing this on your own, again, coming into your, see your favorite Rush PT, Revital Certified Trained, we love to see you. But for those who do feel comfortable performing this, having good balance, I will demonstrate. So I'm going to have my arms out in front of me, and then I'm going to stand up and then try and lower as slow as I can without dropping. Of course, that could be a goal for you. Right now might look something more like that, and that's okay. But working on a slow descent as much as you can. Standing up and sitting down. So I would do as many as you can in a row, up to 10. And so maybe you're just getting to 3 in a row right now. That's perfectly fine. Take a seated break and then see if you can do another set of 3. Eventually building on maybe up to 10 at a time, doing 3 sets of 10 maybe eventually sometime down the road, if that's not where you're at right now. Performing this one time a day to make sure you've got that strength, balance, and endurance going. And so that's kind of the whole overview of what it's like coming to one of us to help you get your strength, range of motion, breathing better, and help you get back to all your daily activities, just make sure functioning easier for you, and hopefully helping you feel better overall, getting you to walk your dog, take a shower by yourself. We'd love to help you with all of that. So if you have any questions about what we went over or anything else about physical therapy, we'd love to answer any questions.
Thanks, Leslie. And so just to point out, I'm at the Harrison Street location, which is the Rush main campus. Leslie's over at our Andersonville location. In terms of closeness to Wellness House, I think our closest Vital certified therapist is in our Naperville location, Sajani. So happy to connect you with her as well. And then just one more, sorry, Brittany, one more additional resource is we actually run a Living Well Beyond Cancer Survivor series. So these are free for all, anyone, doesn't even have to be a patient. So you can join on. I really am excited for this one. This is tips for navigating the holidays. So this is done by one of our OTs, and she'll be talking about just basic ways to kind of manage and navigate, and, work on some of the activity breakdown that Leslie was talking so nicely about, and how to get through these holidays and make them enjoyable still and feel like you can manage them well. So thanks again, and happy to open up to some questions now.